Brian.
Thanks for having me.
Well, Brian, before we go, will you talk to us all about this fascinating program we have here in Silver City? Just talk with us a little bit about your background and how you ended up creating this recovery coalition.
Okay, well, it kind of starts back in the 90s when I began accruing what I call the best way to put it is lived experience, all the way up until today. So, in what was it, 2017, I decided to go back to school. My wife at the time liked Silver City. She thought it was a very eclectic and artsy sort of place. And so she wanted to move here. I looked at the offerings at Western New Mexico University, and they're, lo and behold, the only university that offers a 4-year degree in substance abuse counseling. So I took that opportunity to wrap up my bachelor's degree, and I ended up with a degree in psychology as well as drug counseling. And I minored in pre-law, and I decided that mental health was where I wanted to be. And I have a lot of experience that working with homelessness and people with substance use disorders, people who have survived extreme trauma, all of these demographics. And so I decided to start New Mexico Recovery Coalition to sort of fill a void in services in Silver City.
I really like what we said before we recorded, that there's such a strong need for there being collaboration between the different agencies, Border Mental Health, HMS, SPIN, and all the different organizations to work together and providing something that really is going to directly help and support that individual.
Yeah, well, I did an internship with Jim and Chris Helgert and David Ledbetter over at RMC, and then I did an internship with SPIN. So I got some really valuable behind-the-scenes experiences of how this should work.
Share with our listeners all about what you have in store. I love this idea of the mobile crisis unit, having mental health first responders, also harm reduction. A lot of our listeners may not understand what that is. There's a lot that you can really talk about. So where can you start?
Well, you mentioned harm reduction. I think that's an important key to this. Lots of people have the misconception that harm reduction is enabling people, and it's not. So the Prochaska de Clemente cycle of change is evidence-based theory that person enters into recovery long before their consciousness knows it. This is where harm reduction comes in, because when a person comes and takes the initiative to get, for example, to come in and get naloxone to have in their pocket because they're using fentanyl, that's their subconscious telling them that their life matters and they want to live to see the next day. And that's the very beginning steps of recovery.
That's a really good point that you're making. I think just about every family in this country has been affected by an overdose. In my own family, I shared with you a son-in-law who died of a fentanyl overdose 3 years ago. So it's a story that everyone can relate to, but there's still a lot of misinformation, what that is.
Yeah, absolutely. There definitely is a lot of misinformation. And so what we're doing is trying to engage with the community. I'm doing literally boots on ground, going from door to door and handing out flyers, but not just handing out a flyer and saying, here, come to this event. I'm handing out a flyer followed up with hours of conversation with business owners. It's important that our community, such as, like, for example, the visitor center, I frequently attend the visitor center because that's also a place where our disadvantaged population tends to congregate occasionally. And so it's important for us to realize that nobody woke up one day and said they want to be homeless. Nobody says that. Then you'll never find a 5 or 6 year old who says, I want to be homeless when I grow up. Everybody comes from a life of meaningful support and abundance. I mean, that's just a given. At some point in time, everybody has a past experience where they were successful in life. What we need to do is look beyond the mental health issues that they're experiencing, try and address those as best we can, but also let's take a look at their life before all this happened. What do they do? What do they like to do? What's their hobbies? What would, if they could pick up any hobby in the world and dollar wasn't a figure, then what hobby would that be? And these kind of questions get our homeless individuals and our struggling populations to really open up. And I can't, it's hard to describe the look in their eyes when I ask those questions, because they light up like lights. And the end of our conversation almost always ends with, I can't believe you asked me that. Nobody's ever asked me that before. I'm like, really? Wow. Okay. Well, let's work on that. Let's have more conversations like that.
So, Brian, again, what would be some specific ways that the New Mexico Recovery Coalition can really help an individual? Because we're talking some complex stuff, often trauma in that person's life, a substance use disorder. Maybe there is a reoccurring history of a mood disorder, whether it's major depression or, again, post-traumatic stress. So what can you do to help that person or persons with the collaboration of others?
Yeah. So I view the front line of this movement is like I said, what I keep calling boots on ground. It's going into the big ditch. It's meeting people where they're at. It's going to spin. It's going to the gospel mission and having these conversations with people who otherwise wouldn't normally seek out care, because quite honestly, there's the other side to stigma in which many people don't think there's any care that's going to help them.
That is so common. And very sadly common for people.
And it's easy to resign yourself when you've tried everything in the book to get better and nothing's worked. So I want to be that person that has that conversation that says, you know what? I get you. I understand. I understand the trauma. I understand where you're coming from. I understand your situation. But where do we go from here? How do we help you? And then I want to be able to take those people by the hand to the agency that is best appropriate for them. So if they're experiencing extreme trauma, then we have agencies for that. If they're experiencing substance use disorders, we have agencies that are very strong with treating substance use disorders. If they, for example, perhaps they're court mandated, I want to be sure that these individuals get the treatment that they need, and that they normally wouldn't otherwise go out and seek on their own.
I think our judges need a lot of education on what's the appropriate treatment, because a lot of these individuals need more long-term residential before they can segue back into the community. The judges may not get this here.
Well, the good news is that it's getting better since the 90s, since my first exposure to the criminal justice system, which isn't very just, but, that's another conversation. I think we have very strong judges, very knowledgeable judges here in Grant County, and I can't speak necessarily for Hidalgo and Luna. That is part of the mobile outreach process in terms of engaging the public. I want to sort of have those conversations with the judges and find out what their understanding is. We're blessed here in Grant County to have some very knowledgeable judges as well as district attorneys. So as well as our folks that staff the jail, they're very knowledgeable. I think the issue here is not necessarily about knowledgeability. Of course, everybody can learn something new. That's granted. But the issue here is getting everybody to work together harmoniously and work on the same page.
The listeners were talking with Brian Stengel, who's the founder of the New Mexico Recovery Coalition, and he's talking to us all about how we can do better, in terms of providing intervention and ongoing treatment and housing and resources for an individual with substance use disorder. And those individuals often do have a co-occurring disorder with behavioral health issues.
Yeah, I hate the word comorbid, but that's what they call it technically.
Co-occurring. Yeah, co-occurring, yeah. Not comorbid.
It
could be a morbid. That's a morbid way of calling co-occurring.
But yeah, co-occurring, the philosophical end of that is which came first, the chicken or the egg. Yeah. So did the mental health issue cause substance use? Are they self-medicating because of that? Or did the substance use cause mental health issues?
That's it. And back in the day, I was just in my 20s when my first internship was in a 24-day 30-day detox/recovery center. And back then it was primarily alcohol use disorder was the principal diagnosis. And then as I got older, cocaine, and then more of the, then the methamphetamine, and then heroin, more of the opiate. Once we got the opioid crisis going towards the end of my career, that was becoming a huge issue. So what are you seeing in terms of your work? What's going on in our community in terms of substance use disorder?
Well, I see a lot of people offering MATs, and MAT is short for medication assisted therapy, but they're only offering buprenorphine, and that's a troubling aspect to claiming that you offer MAT when you don't, because MAT also includes methadone.
Explain to our listeners about these different MAT medications, which would be methadone, Suboxone. Mm-hmm. Would Vivitrol also be included in as a MAT? Okay, so share with the listeners more about.
So these are medications that help a person overcome the cravings and the physiological impact that decades of substance use causes. Mm-hmm. Now, I want to say like more than 30 years, methadone has been the gold standard for MAT treatment. And every piece of literature that you look up on MAT has methadone included in that conversation. Buprenorphine came around, I want to say, early 2000s. And so buprenorphine is Suboxone. There's two variations. One is just the buprenorphine. The other has naltrexone and buprenorphine. But that's also a MAT medication. And so there are actually many more people than we know who are treatment resistant to buprenorphine and need methadone. We only have a handful of methadone clinics in New Mexico. We have one in Las Cruces. Now, the methadone protocol that's designated by SAMHSA, which is the overdose treatment program, which is something you have to be certified in order to offer methadone, requires a person to visit the clinic every day, and occasionally they get take-homes on weekends. And because of COVID, we saw many people getting 30-day supplies. That's gone away, and people are now having to go to a methadone clinic every single day. But guess what? We live 2 hours from Las Cruces. So who's going to go every single day, 4 hours there and back, and try and maintain gainful employment and try and have a life other than sitting in a medical transport to Cruces and back?
Yeah, that's problematic.
It absolutely is. And can't understate that there are so many treatment-resistant people that cannot take buprenorphine because it doesn't work for them, that they're going unnoticed. And I hear a lot from the community providers that setting up a methadone program, there's a lot of red tape. There's a lot of, for lack of a better word, hoops to jump through in order to get an overdose treatment program established. Granted, cool. All right, I got you. Methadone is highly regulated. So why don't we tackle these hoops? Why don't we go through these hoops and make it happen? It's obviously something we need.
Yeah.
Let's just do it. Let's just get boots on ground, go out there, get the paperwork, and sign off on the papers and submit the papers to the feds, and get our DEA numbers and get our NPI numbers together, and let's just do it. Let's stop fiddling around.
That's a good point you're making. These MAT medications need to be very readily available.
Well, having a choice of medication is inherently integrated into the MAT philosophy. If you don't offer a choice of medications, then you're not really offering MAT.
Yeah. You want the welcome mat.
Right.
And what else can you share with our listeners about what you're seeing on the streets and these upcoming events that you're doing, which I think is remarkable? Share with us about that.
So harm reduction is a major component of what I'm driving out into the community. Historically, since 95, with our first legislation that enacted harm reduction laws, New Mexico was on the forefront of that. But what they did was they made harm reduction embedded in the Department of Health. So anybody that needs clean equipment they're forced to go to the Department of Health to get that. And I come from a grassroots movement of harm reduction where people are slinging syringes out the back of their car, out of their trunks, right? And that works because think about it. A person who's using substances is literally breaking the law multiple times every day just for possession of whatever substance it is. Why would they go into the belly of the beast to get clean works? That doesn't make sense. It's counterintuitive. So what we're doing is driving these harm reduction services out into the community, into the big ditch, into the places like the Visitor Center, Gospel Mission, SPIN, other agency community collaborators such as Silver Linings, RMC, where we're bringing these services away from the DOH and into the hands of the people that really need them who normally wouldn't go to the DOH to get them.
Well, this is a really, really important work, I think. This has to be done. I mean, again, it's, you talk about the ditch. What's the situation like? What's the situation in that ditch right now? Tell us more about that.
It's amazingly clean. It's much cleaner than people say. I don't know who is running along used syringes and stuff like that, but to date, I have not seen that. And we did a big ditch cleanup on Earth Day. I wasn't able to attend the entire thing. I was there for the beginning. But prior to that, we did a hike through the big ditch and found 0 syringes. We found 0 signs of encampments. It was very interesting. I'm not quite sure where the public is seeing all this stuff because I haven't personally. But the big ditch is an interesting thing. It's a place people congregate. It's a place people go to hang out and get away from the hustle bustle of Bullard Street.
So, what can you do when there's a person that's having a behavioral health crisis? What can be done as, again, collaboratively to help that person and our community? Because we have residents here that talk about feeling unsafe when this what can you share about that?
Sure. And first and foremost, education and training is key. I would not advise anybody to ever do anything without the appropriate credentials first and licensure first and training. So that having been said, I took it upon myself to attend a crisis intervention team training in Alamogordo hosted by the Alamogordo Police Department as well as NAMI and some other organizations to get that training in. And there's a lot to it. There's a lot to being able to interface with somebody in crisis and calming them down. If there's a fight about to happen, my fear response is to get in the middle of the two individuals or the aggressor per se. That's how I handle things. I've been told that I do it pretty well, but in that sense, I'm kind of fearless. Whereas officers take a different approach, and they're trained to consider safety first. Granted, that's great, but our police department is being outsourced to do mental health calls when they're not mental health clinicians.
They do a lot of those.
They're law enforcement. They're there to enforce the law. If no law is being broken, then what the heck are they doing there? Right? So we want to, I'm working with our chief of police, Silver City Police Department, to figure out a way to put and I call it a civilian-led, but it's actually a mental health professional-led mobile crisis response team that's tied into 988 as well as Central Dispatch. So that way we can have a team of providers that can be called out to the scene when the scene's been secured by the police and it's safe. And the police want to be on standby. The chief of police has been very clear in the sense that he does not want to do a police-led crisis team. He wants a clinician-led crisis team. So that's what I'm doing.
It's very necessary.
Making it happen. Nobody else is doing this. So that's why I started New Mexico Recovery, because I am filling the void and doing the work that nobody else is doing.
Well, we're grateful for that, Brian. Talking with Brian Stengel about the New Mexico Recovery Coalition. What else are you offering that's really going to help our community in regards to all of this?
Well, something else I onboarded recently was STD testing, and HIV and hepatitis C And syphilis, especially syphilis. Just recently, I learned that New Mexico, the CDC ranked New Mexico second in nation for syphilis infection.
I heard that too. And, there are a growing number of infants being born with syphilis
Yes.
across the nation.
I think congenital syphilis.
Congenital syphilis, yeah.
So that's a very important thing because syphilis can go undetected. And if a child could be, that's absolutely important. Plus, we know that former or current people, PWIT, or people who inject drugs, they have Hep C. And historically, Hep C was a death sentence. You couldn't get rid of it. But things have changed. And
very rapidly.
There's medications. A person could be, quote unquote, cured of Hep C now.
As little as 60 days. Probably between 30 to 60.
It's
days.
Getting the window of time is getting shorter. So every new breed of medication, the time of treatment is getting less and less. But also HIV, we don't have a huge problem in HIV according to the CDC stats, but it's still out there. And if somebody is worried about having HIV, that creates a mental health crisis for them in the sense that, oh my gosh, I might have just contracted HIV.
Yeah.
If that conversation happens while I'm on mobile outreach, I have HIV rapid tests.
Yeah, great.
And I've been trained by the DOH to provide these tests that can give a person an idea of whether or not they are HIV positive. Of course, it's not a definitive. They do have to go to get their blood drawn because these tests are finger stick tests, but can effectively give somebody peace of mind when they're experiencing a mental health traumatic event by showing them, no, you don't have HIV. You're good. So you don't need to worry about that. Right.
That's it. And also the HIV education, like with PrEP, and there are PrEP and PEP. And it's just phenomenal. We've come very far. Absolutely. And all of this
There's
prevention
an interesting
and
thing
treatment.
that I find the most interesting is you'll see U equals U. Right? Do you know what that is?
No, tell us.
So U is undetectable equals untransmittable.
Oh.
So a person could be HIV positive at some point in time, but if the virus is undetectable, not to say they don't have it, they still have it, it's just undetectable, the science shows that it's untransmittable.
This is good knowledge to have for our community. It really is. Share with our listeners a contact information. How would our listeners reach you, whether to get more information, volunteer, or whatever you think would be beneficial?
Definitely. I want to encourage anybody interested in engaging with New Mexico Recovery Coalition to contact me directly at 505-469-1139. But more importantly, go to our website at recoverynm.org. All our contact information is there.
And the next event, when is that going to be?
Tomorrow.
That's tomorrow.
Yeah. Okay. In Golf Park.
Golf Park. Do you hear that, listeners? Tomorrow, what time?
We're going to kick off at 9 and we'll go until the cows come home.
Sounds good. Moving right along. Anything else you want to say?
Yeah, if you can't make it to that event, I encourage our listeners to come to our Deming event, which is also it's going to be on the 18th at Silver Linings.
This is great. Brian, I would love to have you back on. I think that you are offering a much needed service here. I think it really is time for all of us to work together collaboratively on helping and providing necessary treatment and resources for our more vulnerable community. Anything else you want to say briefly?
Please come out and volunteer. We need volunteers.
Well, thank you so much for being here, Brian.
Thank you.
Community Spotlight airs every Thursday at 10:30 a.m. and is archived online at gmcr.org. You have been listening to Community Spotlight on Gila Members Community Radio, KURU 89.1 FM in Silver City, New Mexico, and online at gmcr.org. We love you, Silver City. I'm Candace Burke. Thanks for listening.